Can you see that okay, Leah?
Yes, looking good.
Okay, perfect. Okay, thank you everybody for joining us today for this environmental health seminar. I just would like to premise this presentation on the fact that a lot of the work we're doing right now at the NCCEH is focused on looking at how climate change is going to impact one of the key, across the areas of our focus groups, key areas of work in environmental and public health practice. And so we're trying to distill down some of these climate change impacts on areas of EPH practice. And one of those areas looking at today is opportunistic pathogens in the built environment. It's quite a big area to cover. So
Okay, it looks like Juliette has frozen.
okay.
She'll be
Okay,
back
I'm
on.
just going to stop my video, see if that helps. Is that good?
Yeah, I think it's clear now.
Okay, thanks.
Thank you.
Okay. Just trying to transfer the slide. There we go. So one of the areas that we've been looking at is, of course, the Health of Canadians and Changing Climate report that was issued this year by Health Canada. And we looked at areas of environmental public health practice that might affect our key user groups. And one of those areas is infectious diseases acquired by inhalation from environmental sources. And so the report highlighted some of the areas of importance, such as increases in Legionella, which could be associated with precipitation, changing temperature, how storms might impact exposure to bacteria and aerosolized particles, and changing ways that we interact with water. So I carried out a rapid review of some of this research in climate change and opportunistic pathogens in the built environment, and that was published this month in Environmental Health Review, a sci-fi publication, which you can access, open access right now. So this presentation is going to give an overview of some of the selected opportunistic pathogens that we looked at, how climate change might affect growth and patterns of exposure to those organisms and infections, and how we look at how we manage opportunistic pathogens. Do we have to change how we're managing those in a changing climate? So just as an overview, opportunistic pathogens, what are they? Often you see them referred to as OPPPs, opportunistic premise plumbing pathogens, or other types of terms, but they're not always just in premise plumbing, so we chose to just call them opportunistic pathogens. They're pathogenic microorganisms naturally found in the environment in aquatic and soil environments, but they really thrive in engineered water systems, such as distribution systems for drinking water, premise plumbing, cooling towers, treated recreational waters. And they cause opportunistic infections in susceptible individuals. We didn't have time to cover all of these, so I just focused on three main groups, including Legionella, which I'm sure you're very familiar with, Mycobacterium species, and Pseudomonas. And so why covering just these groups? They're the cause of most waterborne outbreaks, more so than other types of enteric pathogens. Collectively, they're a major cause of mortality and morbidity among sort of susceptible populations, and they are a huge cost to treat and to manage. There's some common characteristics across these groups, which is important to consider when we're looking at what the climate change impacts would be. There's a preference for warm water. There's a general tendency to colonize engineered water systems and premise plumbing. These organisms also show some resistance to extremes and to disinfection, and they can form or join biofilms or transfer in the water in free-living amoeba. They are also transmitted mostly via inhalational aerosols, although there's other transmission routes, and there's elevated risk for some groups that is important. So looking a little bit closer at some of the unique properties of some of these organisms, Legionella, you're probably more familiar with than others. The main route of transmission is inhalation. In most cases, it's important to note, are sporadic, But when we're looking at outbreaks, most of the outbreaks are linked to cooling towers. We also see outbreaks occasionally associated with hot tubs, fountains, other possible sources of exposure where there's aerosolized infected water or contaminated water. Legionellosis is a reportable disease in Canada, and it comprises Legionnaire's disease, which is a severe pneumonia, which is potentially fatal, and mostly caused by one species, Legionella pneumophila, but also Pontiac fever, which is a milder flu-like illness. And there's elevated group risk among people that are smokers, over 50s, men, people with immune compromised systems or chronic health conditions, and people involved in certain occupations, such as outside workers. Cases of Legionellosis have been increasing, and we do see that cases up till 2019 reported by Health Canada are on the rise, although after 2019, there is a bit of a COVID effect where we don't see that same trajectory of increase, and that could be for a number of reasons, which could be reduced reporting during COVID, as well as maybe co-infections. But generally, why are we seeing this trend of increase, which is here as well as elsewhere in the world? Could it be environmental factors? Possibly, but it could also be due to improved reporting, improved diagnostics, and general awareness that maybe we need to be testing for Legionella. Mycobacterium is the second group that we looked at, which is a huge group of bacteria, which is responsible for diseases ranging from tuberculosis to leprosy. But when we're looking at premise plumbing and potable water, we're concerned with the non-tuberculous mycobacteria, or the NTM, which includes things like Mycobacterium avian complex. And with this group, routes of transmission can be inhalation, but you can also have infections from direct contact. Cases that are sporadic are usually associated with premise plumbing, but outbreaks are more associated with recreational waters, and you can also see infections from medical or cosmetic procedures. There's a wide spectrum of diseases, and these are non-reportable in Canada, so it's a little bit harder to track. Pulmonary disease is one of the major concerns, as well as soft tissue infections, and there is some indication of resistance to antibiotics. Elevated risk is among, again, immune-compromised people, people with cystic fibrosis, and elderly females particularly. And cases of NTM do seem to be increasing. This recent systematic review of a number of global studies found that about 81% of those studies showed that NTM infections and disease are increasing. And across those, it was coming to about a 4% increase per year. And some of that increase may be different depending on the age group. So it looks like amongst older age groups, the rate of increase could be slightly higher based on this study here. Pseudomonas was the last group that we looked at. Again, routes of transmission, inhalation is important, but there's a wider range of transmission routes for Pseudomonas, including direct contact or indirect contact by fomites. And most of the dermatitis outbreaks are linked to recreational water venues like pools and hot tubs, but pulmonary infections are more likely due to infection in healthcare settings. Again, this is a non-reportable disease in Canada, and there's a wide range of outcomes of infection from ear, skin, and eye conditions, wound infections, urinary tract infections, and respiratory infections. And it's one of the major causes of healthcare-acquired pneumonia. Specifically, it's very important for cystic fibrosis patients, where it is one of the main causes of healthcare-acquired pneumonia, causing mortality and morbidity amongst that group. But other patients that have invasive devices, burn patients, etc., could be also at risk of infection. This particular group is a WHO Priority 1 pathogen for AMR risk and the development of new antibiotics, because we're running out of ways to treat this. So what are the trends for Pseudomonas? It's not as clear. Some indication that amongst hospitalized patients, there's a decrease that could be due to better clinical outcomes for those patients, as well as better infection prevention and control. During COVID, we saw some increases in Pseudomonas cases due to co-infections. And what is the climate effect? It's hard to really pin this down. There's one paper that's looking at how climate warming could impact the prevalence of resistant Pseudomonas in some, this was a European study looking at Northwest countries, which are more likely to experience stronger climate change, but the drivers for that change are not quite clear. We do see some seasonal types of effects for Pseudomonas, which indicates that things like warming or precipitation could have an impact in how cases go forward in the future. So there's more information on each of these waterborne pathogens in this new Health Canada publication that was issued in September of this year. So if you do want to look at those, go ahead. And also it covers things like acanthamoeba and Naegleria fowleri, which we didn't cover in this current review. So when we're looking at the possible impacts of climate change on these organisms and how they might cause infection, we're trying to consider how things like precipitation, warming climate, storm events, increasing frequency and intensity of extreme events could influence things like the presence in the environment and their growth and distribution in engineered water systems and premise plumbing. Are there going to be changes and opportunities for these to generate aerosols? And if so, is that going to lead to exposures that cause infection in susceptible people? So across these kind of issues, the environmental factors and the ambient conditions really look at the increasing ambient temperatures and seasonal effects and precipitation and storm events. But we also wanted to look at how human and built environment factors might affect things like exposure. So changing demands for cooling or changing patterns of water consumption. And so I'll go through each of these in a little more detail. The literature shows us that generally these organisms are favorable to more warm environments. So we expect that there'll be enhanced survival and growth of opportunistic pathogens generally in the environment, but also potentially in engineered water systems. And there's that warming effect, which doesn't really stand all on its own. We do see that there's links to other types of environmental factors, but we do see that there are changing seasonal patterns. And a recent study, well, it was 2018, Alarcon and Falcone et al. Noticed that the seasonal peaks in the US for Legionella outbreaks was moving from the mid-September time of year to mid-August. So you're seeing earlier seasonal patterns that may last for longer. So that warming is not necessarily the only factor. We notice that in the literature, humidity is very important. So it's these hot and humid climates that favor Legionella and also NTM transmission. But in hot and dry climates, are we going to see a decline? And that's also mentioned in the Health Canada report that maybe there will be some areas where we see changing patterns. So it might not be an increase everywhere. The key concern with rising ambient temperatures is that enhanced growth in the environment and it becoming increasingly difficult to maintain low temperatures that prevent growth, sort of below 20 degrees Celsius, either in distribution systems or in premise plumbing, especially in urban centers, which are more affected by sort of urban heat island effects and that general warming. With rising temperatures, we also see increased rate of decay of disinfectant residual, which was one of the main control measures for these types of organisms in premise plumbing. Looking at precipitation and storm events, the literature tells us that rainfall is strongly associated with Legionellosis, and there's a time lag there of several days. Their association with NTM and other types of OPs is less clear, and that could be due to extended incubation periods for those organisms. But generally, heavy precipitation, especially following things like a wildfire or, big flooding events could lead to contamination of source waters with storm flow. Those source waters become harder to treat. They also enhance growth in the environment for these organisms, which have more sources of total organic carbon and nutrients. And then that source water becomes more difficult to remove turbidity and organics and nutrients, etc. There's also possible increased generation of aerosols during heavy precipitation events that increases exposure in ambient environments. During storm events and wind, we know that wind-blown debris has been found to contaminate cooling towers. And so that depletes disinfectant residuals, and it also allows for more nutrients and things for those organisms to consume and grow. Storm and wind events can also increase dispersion of bioaerosols from cooling towers or more distant sources. And there's a couple papers now that are pointing to wastewater treatment plants as potential sources of Legionella exposure. Floodwaters and mud can also be a source of exposure. And there's several studies that have looked at people who are involved in flood water and mud cleanup, elevated risks of Legionella amongst those groups. So our key concerns here with precipitation and storm events are the potential for increased contamination of source waters, so enhanced growth and increased treatment challenges, and potentially increased aerosolization of Legionella. And some groups may be more at risk, such as people who work outside or exposed to ambient conditions, and also persons involved in flood cleanup. Moving on to how sort of these human factors and built environment factors could affect our exposures, etc., to opportunistic pathogens. We know that cooling towers especially are prone to colonization by Legionella, and they are a primary source of Legionellosis outbreaks. Our key concern there is that with wind-blown debris, with warming, there's an increase in favorable conditions for colonization of these systems, and also for dispersal of aerosols from cooling towers. We know that cooling demand in our warming cities is going to go up. So we could see an increased number and duration frequency use of cooling systems. And cities like Vancouver are now moving to a maximum temperature standards where new builds are going to have some type of mechanical cooling system. So we could see that our urban centers become more cooling towers and more sources of cooling. Our changing demand for cooling could also be new sources of exposure to aerosols or increased exposure to aerosols in places that use water misters for cooling. And this past summer, I'm sure you've seen them around. There's a lot of places where you have cooling stations that are using water misters. And there'll also be new and increased sources of exposure for potentially green infrastructure that is used for cooling these urban centers. So your green walls, how are you watering those? Is there some type of spray irrigation, or is it a drip irrigation? So those factors could change how we're exposed to aerosols in urban centers. This study from Australia from 2021 was looking at these opportunistic pathogens in water mist systems. And across biofilms, bioaerosols, and water samples that they took from these systems, there was a high level of detection of opportunistic pathogens. Pseudomonas was found in 44% of samples, more frequently in bioaerosols. Legionella pneumophila was also in about a quarter of these samples. Good result that there was no NTM species detected in this study. But this does show us that these systems can be colonized by opportunistic pathogens. So they are there, they are aerosolized, there's potential for exposure. So we need to pay attention to how we're using these systems and maintaining them. We're also changing our patterns of water consumption based on sustainability issues. So this quote from the Environmental Commissioner of Ontario, municipal drinking water treatment and pumping accounts for 1/5 of municipal energy use. So water use, potable water use, is a big energy consumer. And so addressing climate change also includes reducing water consumption and water waste. And so we're moving towards more water efficient devices. We're looking at automatic or low flow devices that reduce consumption, and also more types of water reuse, so gray water or rainwater harvesting. But does this affect our exposure to opportunistic pathogens? Does it improve conditions for them to grow? And yeah, probably. So we see that with periods of low use or water efficiency measures in distributed water systems and in premise plumbing, that increases the water age. So basically the residence time of that water inside that closed system. And the more time that water spends inside that system, you see reduced disinfectant residual and enhanced growth conditions for opportunistic pathogens. So water age can be quite important in assessing our level of risk. Electronic faucets as well, they can facilitate colonization of plumbing fittings, especially around, the taps where there's low flow, there's low hydraulic type of action that is clearing out those systems. And there's also limited temperature control. It's set somewhere in that kind of cozy area that opportunistic pathogens really like, sort of that warm, not too hot, not too cold sort of level. In harvested rainwater or gray water systems, we know that these systems can be sources of opportunistic pathogen growth if they're not managed well. And so collection surfaces, especially say following a wildfire where there could be debris or ash on those rainwater collection surfaces, that material is coming into the collected rainwater and it's providing a source of nutrients, of turbidity, making it harder to treat that material. And you do see growth in this material or this water. And if there's an opportunity for that then to be aerosolized, that can be a point of exposure. So whether that's used in cooling towers, irrigation, toilet flushing, etc., that could be new sources of exposure. So we need to be aware of both the safe collection and treatment of that water, as well as how and where people are being exposed. So going back to this sort of diagram, looking at how we look at these things and how the climate might be affecting the presence in the environment, growth and distribution, opportunities for aerosolization and exposure to susceptible people. Do we need to change what we're doing? And really, we know that overall, there's going to be a possible increased contamination of source water, potentially cooling towers, or other raw water sources that make treatment more difficult. There could be an increased colonization of engineered water systems due to changing temperature or patterns of use. And it may become more difficult to maintain opportunistic pathogen-free systems, which there really aren't that many systems that are completely free, but to maintain low levels anyway. And we're also seeing that there could be increased exposure to aerosolized water in the built environment, either outside during storms, precipitation, wind events, or due to more
All right. It seems like, Juliette, we just lost you for a quick second. Okay, I wonder if we'll get Juliette back. Let's just see.
get frozen there.
Oh, okay, there you're back. Okay, wonderful.
Where did I cut out there? Sorry, Leah.
So you were just finishing up your last slide, the overall slide. And I think you're on your last point there.
Okay, sorry about that. Yep.
Oh,
so I finished this one and I'm on to this one. Okay, yeah, so great. Our existing controls, do we need to change what we're doing with our existing controls for opportunistic pathogens? And we can think about how we may have to change hydraulic controls, how plumbing materials might affect things differently. Do our temperature controls, are they still feasible? How do we limit nutrients, and do we have to adjust disinfection practices? And we know that there are existing systems already for building water systems, but across the whole spectrum from environment to point of use, how do we really manage our changing risk level here? So there's going to be upstream measures, including source water protection and adapting our treatment systems and practices for a changing climate. And that's seasonal changes as well as the impact of events such as flooding, precipitation, falling water, wildfires, pardon me. Source water could become more contaminated with turbidity, total organic carbon. And how does that affect, first of all, how we treat that water, how we disinfect that water, and how we maintain secondary disinfection and disinfection residuals in our systems? Also, how do we maintain high quality water within our distribution networks? Will climate change affect those in-pipe factors that enhance growth or reduce disinfection residuals, such as corrosion, formation of biofilms, available nutrients? And how do we balance adequate disinfection with the risk of disinfection byproducts, which we don't want to just add a bunch of chlorine into a system and hope for the best, because we know that's not the solution that we need. There could also be changing hydraulic conditions in these systems during periods of low use or drought. There have been many studies that looked at pipe effects and pipe materials and how these influence things. And disinfectant type and dose generally has the strongest influence on the microbiome within distribution systems and pipes. But pipe material can become more important as water ages and disinfectant residual reduces. But how would other factors such as extreme heat events in the environment, in fact, affect some of those in-pipe factors? There's probably more research to be done in that area. When we look downstream at point of entry or point of use, do we need to consider different controls, such as different types of disinfection, including UV disinfection or membrane filtration, changes to how we flush systems or apply heat shock? Or are there design controls we should be considering to reduce water age? So better sizing of pipes and storage systems to demand of the users to reduce the chance that water is aging. Water management plans are already in use, but are the controls still relevant in a changing climate? Are there new areas of risk do we have to adjust to? Or do we need to revise these systems more frequently or implement some type of seasonal measures or measures following storms or precipitation events? Are operational and maintenance procedures still feasible? So one of the controls for Legionella is maintain your cold water systems cold at less than 20 degrees. Is that still feasible in warming buildings? And do we have to change our inspection, monitoring, and maintenance procedures to account for maybe increased colonization of systems? And we see cooling tower registries becoming more important and more of interest in a lot of jurisdictions. And these can inform good water management practices as well as facilitate outbreak investigations. So there's more on that on our Legionella topic page. So please go to our website to have a look at that. I just wanted to, include another additional consideration that some socioeconomic groups are at higher risk of exposure due to health inequities that exist within certain groups, different workers that are exposed differently, as well as neighborhood factors. So we need to keep that framing in the background when we look at designing whether or not we need to adjust our risk management practices. And where do we start here? Do we look at those most at-risk buildings, neighborhoods and regions, and also those most at-risk persons? And I'm not going to read that out because I think I'm probably running low on time, but looking at where these impacts are going to be happening most significantly, and then looking at who's going to be most impacted and how we can maybe adjust what we're doing to address those most at-risk people and focus our risk reducing measures. There are some challenges, of course, and we have these trade-offs of balancing water treatment objectives with things like public safety concerns. So if we're using temperature controls to flash heat shock a system, there's scalding concerns. Maintaining hot water too hot is a scalding concern. Adding too much disinfection is a disinfection byproduct concern. So how do we address these conflicting issues, as well as the sustainability issues such as water and energy conservation? So we want to be mindful of reducing our water and energy consumption, as well as not increasing our risk of exposures or infections among susceptible people. And across this, who is responsible for taking action? And this is maybe one of the biggest challenges in this area. Source water protection is one big area that yes, everybody's has some kind of involvement in that. But following a wildfire, following a flood, how do we get that message from upstream treatment to downstream protection of the user of that water system? And how do we adapt those water treatment systems, maybe seasonally, on an event-based basis, within the water distribution system as well? How do we address these new risks, and who's responsible? Once the water reaches the plumbing, well, that's the building owner usually, and water management plans are becoming more required in a lot of buildings that didn't have them previously. And there's new mechanisms for improving how people are using water in buildings. In the UK, for example, there's requirements now for landlords to include a Legionella risk assessment in any new lease agreement. So that's looking at what the risks to their tenants are and how they're using their tools available to them to reduce risk. But landlords are not really a group that has a good awareness of how to manage Legionella, and they have limited control at the premise plumbing spots, and they maybe only own one flat within a large building. So how much influence they can actually have is probably limited to maintenance of their plumbing fittings and maybe flushing during periods of low use and that type of thing. But deciding who's responsible in that whole group is quite important. And then when we're looking at things like cooling tower registries, who is having oversight of those? And City of Vancouver now has a new cooling tower registry for cooling towers, as well as decorative water systems. And so that includes some type of routine inspection and monitoring. So we have an idea of what the quality of the water is in those systems. And also that can help if there is an outbreak to trace that back to some specific area. So I'm going to leave it there and leave it open to some questions. Please have a look at the article. That's in EH Review. It has much more detail in all the references, and happy to have any questions.